I'm Kamkama Aloysius, a medical intern nurse in Uganda, Kampala. Studied Bachelor's of Science in Nursing from Bishop Strat University. My study is about perceptions and practices about diabetic nutrition among people receiving healthcare services at Tagata Hospital, Shema District, one of the districts found in southwestern Uganda. And the following discoveries in my study. Diabetic nutrition was understood by study participants as a balanced diet or a restrictive diet. A balanced diet whereby people knew it's a balanced diet by eating well, feeding well, to avoid other foods that may cause problems. Then restrictive diet, here people understood it as, or the study discovered that people think this diabetic nutrition, it's where people are limited to eat foods of their choice or preference. Study participants had different effective sources of diabetic nutrition information from health centers, medical workers, from community health workers, from nutrition diabetic books, and from radio stations, social media platforms. Diet education was discovered on different lifestyle patterns, observing diet and inaccessibility of good diet. Whereby people had different lifestyle patterns of maybe like eating, had different regular feeding patterns in the morning. They took different foods, afternoon and evening as supper. And also observing that people had different kinds of foods in their meals they took, and sometimes the study found out that study participants had different sources of this diet that we call diabetic diet. Campaigns involve family and community support can increase their oversight over diabetes and the diet of these diabetic patients, more especially the partners of the diabetic clients to be involved in their family and community support towards diet. Government support to diabetes is highly recommended and waited for. The way how governments of different nations have been supporting different conditions, diseases that affect their people. So government can also support diabetic management. The following are the recommendations of my study. 1, availing proper and recognized sources of diabetic information to diabetic clients and the public or the whole nation at large. Really, people need to know to have direct sources where they should know if they want to know about the diet for diabetic people, where can they access the right information. Diabetic nutrition and sensitization. People understood this diet in their own different specific ways, and it's very important for them to know how they can be guided and they can receive the clear information in their respective places, whether in rural areas and public areas or town areas. Encouraging direct involvement of partners, of affected persons or affected clients, diabetic clients in management is a core and is a cornerstone in nutrition programs for diabetic clients. Provision of financial, physical and psychological support through public organizations or what we call non-government organizations to these diabetic clients, more especially like the International Diabetes Federation. Community trainings and family support services are highly recommended for this diabetic nutrition. Thank you so much. That's the recommendations of the study that was done on perceptions and practices about diabetic nutrition among people or diabetic clients receiving health care services.